Good morning. Today is Friday, March 17th, 2023. You should have in front of you voting list 16. We're going to start with David's bills. So David,
The first bill on the list is Senate Bill 347. This is a local alcohol bill that authorizes the Baltimore County Board of License Commissioners to issue a Class B education conference facility / dining service beer, wine, and liquor license to an individual who is authorized by Towson University. UMBC already has this authority. The bill makes other conforming changes to specify that the provisions of the license apply to either UMBC or Towson. The bill has the support of the Baltimore County delegation.
okay, are there any questions about Senate Bill 347?
Move favorable.
Have a motion and a second for a favorable on Senate Bill 347. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Next bill was heard yesterday. This is from the Attorney General's office. It's Senate Bill 665. It requires the Maryland Department of Health to investigate whether assisted living residents have been subjected to neglect or physical abuse when a person is found to be knowingly and willfully operating, maintaining, or owning an unlicensed assisted living program. The person operating the unlicensed program must be subject to immediate prosecution on receipt of credible allegation or after an investigation finds that the residents have been subjected to neglect or physical abuse, or if the person fails to or refuses to cooperate in an investigation. If the health department finds no reason to believe that residents have been subject to financial exploitation, neglect, or physical abuse, the unlicensed program will be required to comply with licensure requirements within 30 days. The bill also repeals the requirement that written notice be sent to an assisted living program found to be operating without a license 30 days before filing charges in order to give the program time to come into compliance with licensure requirements. That apparently was the reason for the bill in the first place, because people could come into compliance and then continue operating. You have a reprint in front of you with amendments offered by the Attorney General and one from the chair. If you go to the reprint, you'll see that the bill the title has been added to be called the Senator Dolores Kelly Residents of Unlicensed Programs Protection Act.
Like?
That's the chair's amendment. And I spelled it wrong. I'll get it right. It's a yes. Okay, sorry. We'll fix that. Yeah. I better circle that.
Therefore.
Yeah. Yeah. I thought I. Yeah.
Can I get a favorable on the E?
Okay. You got to go through a few others. The rest of the amendments offered by the AG are clarifying. It specifies that it has to be a credible allegation and operating without a license. And the bill came in saying the department's designee, and it clarifies that you're really talking about the Office of Healthcare Quality in all these instances. Also, it adds exploitation that wasn't in the bill as introduced, and strikes physical abuse, and because abuse is abuse regardless of whether it's physical or not. So those are the changes offered by the AG, and the very last page of the reprint, it authorizes the department to adopt regulations to implement this.
Okay, are there any questions about the amendments? Senator Hayes, then Senator Klausmeyer.
Fantastic bill, David. Question, did the Department of Human Services weigh into this at all? Because I know they currently investigate cases of exploitation of seniors. It looks like this bill has the Department of Health doing the investigation.
This has to do with programs, not just general.
The programs, not
abuse.
the individual.
Yeah.
Got it. Okay. Thank
I
you.
mean, they certainly still have a role to play here, but no, this deals with getting at the owners of these programs.
Yep, absolutely. Thank you so very much.
Vice Chair?
Yeah, David, you still do not have to have a license, correct?
Every facility has to have a license. The issue always has been the smaller guys. There's thousands of these. It's very hard to regulate them.
Right. Right.
So, but
okay.
no, to open up a assisted living program, you have to have a license.
But so these small guys just open something up and say, come in and stay in my house.
Yes, that's the problem. There's no real regulation of the small guys because there's so many. And OHCQ has been understaffed for
Yeah.
years.
So, but if they get caught, then this all catches up with them.
Yes,
Okay,
this
thank
alters the law, so there's more teeth to go after these folks who just move folks around or get other people to take over their businesses.
Thank you. And this, I just looked in the file, the Department of Health put in a letter of support for the bill. So, all right, you have before you the amendments and Senate Bill 665. Are there any questions? I'll entertain a motion.
Favorable.
And second from Senator Ellis. So I have a motion and a second for a favorable on Senate Bill 665, the Senator Dolores Kelly Residents of Unlicensed Programs Protection Act. All those in favor of the bill as amended, raise your hand. That bill receives a unanimous favorable report. Oh, yes. Anyone interested in being a co-sponsor, raise your hand. And that's a unanimous full committee support and co-sponsorship of amended Senate Bill 665. Next bill.
Okay. The next bill on your list is Senate Bill 794. This bill was heard yesterday and it would have required that you have a reprint in front of you. I'll just go to the reprint because the amendments offered by the sponsor working with the health department sort of rewrite the charge here. As introduced, the bill would have said regulations adopted under this subtitle may not require a program to comply with certain other regulations. So it's rewritten to be more of a positive way to write things. The department shall adopt regulations under this subtitle that establishes food service facility standards that are appropriate to smaller residential facilities licensed by the health department. Those licensed are listed under COMAR 1, 2, 3, and 4. I was trying to come up with a way to actually go to the specific statutory reference for each one of these, but they're all over the place. So I think the COMAR reference is better and gets right at the facilities these sponsors trying to get at. Most of these are residential or some are substance abuse facilities. Some are a little more complex.
Okay, Senator Guile.
Yeah, David, I know that the bill sponsor was concerned about some of these like smaller programs and the requirement to have very expensive commercial kitchens. And by just saying that the department shall adopt regulations, there's nothing to say that the department could then adopt regulations still requiring these programs to have these commercial kitchens then, right?
Yeah, there's nothing, the regulations are designed to have standards that are appropriate to these, and the department worked with the sponsor on these amendments. So
Okay.
this is language the department is okay with. So no, it doesn't prevent them from going beyond that, but the idea is to get these standards that are appropriate to these facilities that have fewer than 17 residents.
Okay, so then hopefully that they would enact or adopt regulations that would kind of ease these requirements of the commercial kitchens that are really expensive.
Yes, and for the smaller facilities, not the larger residential facilities.
Okay, good. Thank you.
Thank you. Senator Beidle.
Thank you, Madam Chair. I think a question for the sponsor. What's the problem we're trying to fix?
These are small residence setups. They're not your typical institutional housing setups. And what's happening is they're getting lumped in with the institutional type regulatory scheme, which is exceedingly expensive, but more so, it just doesn't make sense. So these homes are oftentimes, repurposed domestic residential homes, and they've been converted and they've been broken down. And part of the process is that individuals that are in recovery are not only in recovery from addiction, but they're also developing life skills. And it's a better practice model to develop a life skill in a real life kitchen as opposed to a commercial kitchen. They're not getting trained to go work in hospitality. They're getting trained to go out on their own, to live in a home, to cook, prepare food, learn some standards, and it's actually a better practice to have a home style kitchen up to standard with health department requirements, but you don't need a range and a hood
Right.
over top of, over the electric burners and things like that.
I just didn't know what we were trying to fix. Thanks,
Yeah,
Senator.
yeah.
Thank you. It was. It's almost as though someone was auditioning to be the floor leader. I don't know. What do you think? Yes, so we have before us Senate Bill 794 with amendments. Are there any questions on the amendments or the bill? I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable. That was Senator Mounts on the second. On Senate Bill 794 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. I think we're done with David. Thank you very much. And we'll turn to Nathan.
Next on the list is Senate Bill 125. Senate Bill 125 as amended establishes the business diversity program, the Business Diversity Incubator Program and Fund in TEDCO for the purpose of providing grants to qualified incubator programs to establish diverse and effective business incubators in the state. So the bill establishes requirements for grants, including limits on the amount and duration of the grants. The bill also establishes the Diversity Incubator Fund and authorizes an appropriation of $1 million in fiscal 2025. TEDCO is required to report specified programmatic information to the General Assembly. The amendments establish the Incubator Fund, adds requirements for qualified incubators and the grants issued under the program, and alters the mandated appropriation. Looking at the reprint, the most relevant changes are on page 2 of 2, where the amendments describe a qualified incubator to mean a nonprofit organization, B corporation, or social enterprise in the state that primarily serves or will primarily serve businesses in the state, requires or will require participating businesses to engage in a formal incubator program designed to advance early stage businesses, is staffed or will be staffed by at least one individual dedicated to mentoring businesses, and then directed by an individual who's completed a training program focused on a variety of things that are listed under the bill.
Okay, you have before you Senate Bill 125 as amended by the sponsor, Senator Ellis.
Yeah, thank you, Madam Chair. Nathan, I was looking at the fiscal note for fiscal year 2025, and it has a 0 in there. But you said $1 million should go in 2025?
So the authorization to appropriate $1 million in 2025 is added by amendment.
Okay, great, thank you.
Any additional questions on Senate Bill 125 as amended? If not, I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 125 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is Senate Bill 145, which authorizes the State Board of Social Work Examiners under specified circumstances to issue a conditional license to an applicant who, except for passing the required examination, has otherwise completed the education and experience requirements for a license to practice bachelor or master social work. The board may issue a conditional license if an administrative delay prevents a required examination from being available to an applicant for at least 15 days. The license is valid for 180 days after the examination becomes readily available to the applicant. So there are amendments to the bill that are offered by the chair, and the amendments require the board to report specified information about the issuance of conditional licenses to committees of the General Assembly. The amendment further authorizes the State Board of Social Work Examiners to issue a temporary license to practice bachelor or master social work to an applicant who, except for passing the required examinations, has met the appropriate education and experience requirements for licensure. A temporary license is valid until the earlier of notification of permanent licensure or 2 years after the date on which the temporary license is issued with specified exemptions. for renewal. The bill is amended to be an emergency act and will remain in effect until July 1, 2025, when the bill sunsets. The provisions of this bill are in part related to Senate Bill 871 as amended, which will be discussed later on the voting list.
Senator Mounts.
And this bill is different than the bill dealing with the moratorium and.
Correct.
Right. They're not combined or associated. Thank you.
Senator Reedy?
And is it fair to say this is like an amalgamation of a combination of Senator Washington's 872 and?
That is correct. The temporary license provisions of this bill are from Senator Washington's 872.
Okay, great.
Any additional questions? Senator Lamb?
Thank you. Are we still going to be dealing with the sunset extension for the Board of Social Work Examiners? That was a different bill, right?
So the sunset extension for the board is included in Senate Bill 871.
Okay, which is later on the list.
Yes.
We'll discuss it there. Okay, all right. I will bring that back up then.
Okay, no, I just want to personally thank, I've had several members that have given input to this bill and helped shape the product that's before us. It's taken a lot behind the scenes. We've all heard from a lot of folks on this bill, so thank you all for weighing in. You have before you an amended version of Senate Bill 145. Are there any questions? Oops, thank you. Have a motion and a second for a favorable on Senate Bill 145 as amended. All those in favor, raise your hand. Okay, that bill receives a unanimous favorable report. We'll move to the next bill.
The next bill is Senate Bill 187, which as amended prohibits a health occupations board from denying a license, certification, or registration to an immigrant if the individual meets the relevant educational training or professional requirements for the profession. The bill also authorizes the use of an individual taxpayer identification number for licensing purposes and makes other related changes. The amendments offered by the bill's sponsor authorize a board to require an applicant to provide alternative documentation in an application file as authorized under federal law. That provision can be found on page 3 of 4 of the reprint. The amendment further prohibits a health occupations board from requiring that an applicant provide proof that the applicant is lawfully present in the United States or have a social security number or individual tax identification number as a condition of licensure, certification, or registration.
Thank you, Senator Vital.
Thank you, Madam Chair. For council, if you're an employer, when you're hiring someone, you have to complete an I-9. And an I-9 requires certain documents, and one of them is proof of residency. So if we help get these folks licensed, but they still can't be hired, we haven't helped them.
My understanding of the amendments is that they address concerns that were raised by the Comptroller's Office and the Department of Labor related to state taxes or unemployment insurance contributions. As it pertains specifically to that form, I don't have any information about that.
So my concern is the very last page where it says a health occupation board may not require as a condition for licensure to have a social security number or an individual tax identification number, which is the ITIN. So, I mean, I just think it's a problem. I can see they don't have to have a social security number. I don't have a problem with that, but they should at least have an ITIN. How else do they pay their taxes?
Yeah, Senator Ellis.
So, yeah, thank you, ma'am. So remember in the testimony, the issue was bringing in healthcare professionals, nurses, who had to have a social security number before they could be processed. And they had to go in Maryland, the way the rules are, they couldn't get that social security number until they were processed. So they had to go out of state, like in Florida or Texas, to get the paperwork done, and then move to Maryland. So this is not necessarily for someone who is undocumented who will come and get in the workforce. This is to allow mainly nurses to come into Maryland first to get the paperwork done and to get the license in Maryland. So it's not they will not have a social security number to work. It's just that this bill eliminates the problem of them coming to Maryland and doing their paperwork here and for it to be seamless. Sure, no problem. Thank you.
Thank you very much. Audition for floor leader once again. All right, so you have before you the amended Senate Bill 187. Are there any additional questions about the bill or the amendments? Then I'll entertain a motion. Have a motion and a second for a favorable on Senate Bill 187 as amended. All those in favor, raise your hand. Unanimous report on Senate Bill 187 as amended. Next bill.
As amended, Senate Bill 362 requires the Department of Health to apply for specified planning, development, and implementation grant funds related to certified community behavioral health clinics from the Substance Abuse and Mental Health Services Administration for fiscal 2025. And the bill further requires that the department apply to the same administration for inclusion in the state certified community behavioral health clinic demonstration program for fiscal year 2026. The amendments strike the bill as introduced and implement the bill as described.
Okay, you have before you Senate Bill 362 with sponsor amendments. Are there any questions? I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on Senate Bill 362 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Senate Bill 377, back on the voting list, as amended, clarifies that certain workers' compensation benefits available to specified public sector employees are limited or offset only if the benefits are based in whole or in part on the same body part. The amendments offered by Senator Kramer strikes provisions from the bill related to hearing loss and tinnitus, modifies provisions of the bill related to the offsetting benefits as described, and specifies in uncodified language that the intent of the General Assembly is to abrogate the holding in the Supreme Court of Maryland case Spivak versus Montgomery County, and that the act be applied in a manner consistent with prior precedent. Additional uncodified language requires, this is additional uncodified language since the last voting session, requires the Joint Committee on Workers' Compensation Benefits and Insurance Oversight to conduct an evaluation of the effects of the bill on benefit offsets by December 1, 2024. This study requirement comes at the request of certain larger counties. And with the addition of this amendment, those counties have withdrawn their concerns.
Okay, I have Senate Bill 377 with sponsor amendments before us. Senator Reedy.
Thank you, Madam Chair. I just want to thank the sponsor and for working with the stakeholders. I think we all wanted to support the bill, but there was concerns from local government. So I think making sure we study it, make sure it gets put together in the right way was addressed. I think some of the concerns or a lot of the concerns. And so I think I appreciate the hard work to make it happen because we want to take care of our firefighters. We're just trying to figure out how to make sure it worked with the local budgets and stuff. So I move favorable.
Have a motion and a second and much concurrence from nodded heads on that.
we just heard another audition for.
So we have before us a motion and a second for a favorable on Senate Bill 377 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is Senate Bill 460, which requires Medicaid beginning January 1, 2024 to provide coverage for gender affirming treatment. The bill expresses the intent of the General Assembly that Medicaid provide gender affirming treatment to all Medicaid recipients for whom gender affirming treatment is medically necessary. There are amendments from the bill's sponsor that authorize each healthcare provider offering gender affirming treatment with which an MCO has an active contract to consent to being included in a certain report or to being publicly listed as part of the department's annual report. An additional amendment is offered by Senator Reedy, which would limit the requirement that Medicaid provide gender affirming treatment to an individual over the age of 18. So you have two reprints for Senate Bill 460. You can find Senator Reedy's proposed amendment on page 2 of the first reprint, and that reprint also includes the bill sponsor's amendments. There is a second reprint. Senator Mounts has offered an additional amendment, which is shown on alone on the second reprint, which requires that parental or legal guardian consent must be provided for individuals under 18 who are seeking gender affirming procedures offered under the new section.
Thank you. Senator Reedy.
So my amendment just basically says for these treatments, already Medicaid provides for a number of these kinds of treatments. This bill expands it to a lot of other procedures that are not currently in the scope of what we provide under Medicaid. And currently under Medicaid, there are some treatments that under 18 can receive, particularly counseling and other types of therapy and hormonal therapy with parental consent. I think if we're going to expand dramatically what Medicaid pays for in this space, I think we should basically follow what's becoming the lead from places like Europe and say, let's slow down on some of these other things, particularly things that could be difficult to reverse, and just say for taxpayer funded purposes for these procedures, things like alterations to the face and neck, alterations to the abdomen, chest, trunk, and buttocks, alterations to the voice. And there are other things listed here that go further than that. I think it would be great if we just limited that to you have to be above 18 for Medicaid taxpayer funded purposes. And so that's my amendment, and I would move the amendment. Yeah, I think like hormone therapy, hormone blockers, puberty blockers, and a lot of these other things. I think I would move the amendment just to say, let's for this expansion, let's make it, you have to be 18 or older.
Can I ask you, especially since we didn't have a second yet, I'd like to hear from the members who have their mics lit up, and then we can take up each of the amendments separately, if that's okay. Senator Hayes, then Senator Lamb, then Senator Guile.
Thank you, Madam Chair. I'm not sure if this amendment is necessary, but I want to defer to Senator Lamb because I think he articulated to us yesterday the fact that these are medically necessary, and I'm guessing he might say the same thing. So I'm gonna hold off. Thank you, Madam Chair.
Senator Lamb.
Well, thank you, Senator Hayes. So I do agree with Senator Hayes that I don't think it's necessary for a few reasons. So right now, the standard of care, so Medicaid does cover gender affirming care for those under the age of 18. But the standard of care is really only for hormone blockers and puberty blockers. That, you know, in almost no other instances would a provider offer anything else like surgery or anything that could not likely be changed. And so really for those under 18, they're only getting, if they qualify or are medically determined to be necessary by a provider, just puberty blockers and hormone blockers. And the other concern, I think, is that if we were to block treatment for those under age 18 that are covered by Medicaid, there are folks who are receiving puberty blockers and hormone blockers. They would have to stop immediately this treatment, which would have unintended consequences for those who may already be cared for. You know, and I think a lot of these folks, there's also a disparity issue here because private insurers already covered this for those under the age of 18. So really blocking Medicaid coverage of this would only prevent those who are lower income from having equivalent care to those who would otherwise have private insurance. And I think it's also important to note that those who receive puberty blockers or hormone blockers it's not necessarily all for gender affirming, care needs that would be what folks are thinking about under this bill. There are folks who have precocious puberty who may, have early onset puberty. And so there are other medically necessary reasons to also cover hormone or puberty blockers for those individuals too. This would leave no exception for them.
Thank you, Senator. Senator Guile?
Thank you, Madam Chair. I'm not sure if I have any questions now that Senator Lamb very appropriately took care of it. Maybe I should have. Thank you, Madam Chair.
Thank you. Back to Senator Reedy.
Thank you, Madam Chair. And it's a great point about hormone therapy and other types of things could be needed in outside of the scope of this bill. This bill seems to be pretty clear what it's talking about. So there are ways to, I understand that point of it. What I would say is, so right now, unless you're 18, you cannot get, for example, top surgery if you're a young woman that is transitioning to a male, correct? If you're under the age of 18, is that correct in Maryland?
It's not standard care.
But this bill here says alterations to abdomen, chest, trunk, and buttocks. So is that, would a double mastectomy be considered an alteration, or would that need to be spelled out in the bill for that to be law?
The bill states that, which part of the bill are you referring to?
Looking at page 3 of the reprint on the list of gender affirming treatment includes.
So that's the list that covers all the standard of care for gender affirming treatment. But for those who are under the age of 18, it is standard of practice to not do surgery for those folks. It's really just hormone treatment or puberty blockers. And that's basically it for those who are under the age of 18.
So
And
then
so
why is an under 18 block on well, I know my amendment blocks it all, so in fairness, but would it be okay to block? I'm just concerned about lasting things being done before someone is, I mean, we have discussion in this body all the time that folks are not, their brains are not fully formed until they're maybe as old as 25. I don't really agree with that, but that's sort of the standard of political care here in this General Assembly about criminal stuff. So I'm concerned that you have somebody who's maybe 13, 14, and I believe you when you say it's not standard care, but it's happening. There is happening in other states, and that's not law. Standard of care can change, right? I mean, until 2019, WHO didn't recognize a lot of this as appropriate standard of care, and now they do. I'm not sure what that was all based on. It may have been based on a lot of things, but so are you saying that, right? I mean, if this is in the bill, it's an alteration to the abdomen, chest, trunk, could that be considered a surgery? Like we're discussing?
It could be a surgery, but the standard care is not to do surgery right now for folks.
Right.
Two, we generally don't legislate clinical practice. And so this would be a limitation on the provider's decision to work with that individual patient to decide what's best for that individual. And so, I think we start going down a slippery slope if we tell providers what you can and can't do with a patient with their consent through legislation. And it's also important to note that under the age of 18, they have to have parental consent. They can't do it on their own. This parental consent is required. And, medicine always changes too. And so it's I think concerning about putting limitations on what could change in future practice. So, I think it's important to kind of bear all of those in mind. And I think there's a good reason to have parental consent here involved as well.
Thank you. I would just say we're not just talking about standards. We're talking about what taxpayers are paying for too. So that's why I think it would be good. You can always come back and change it later. It's very clear this bill will move. If we put a restriction on it and we find out we need to change it in a couple of years because now the standard of care is shifting to some places that I can't imagine we would want to go, but then I think you could come back and remove it. But I think I would just press my amendment and say I think we should have that restriction for now on Medicaid funded operate. I understand your point about some of these other things, but I mean I would if this was, I know we don't like conceptual amendments, but to me I would just like to press the amendment and call for a vote on it and let the chips fall where they may.
That motion fails for a lack of second. So we now have before us, the sponsor.
I didn't hear, ask for a second.
He made it, the motion. I don't usually ask for a second. Somebody either offers it or they don't.
Conversation.
Okay.
I-
Do you want to try again?
We just move, we have this in as a safeguard. We can always come back and revisit it.
Stay tuned.
If that's the formal motion, then I would second the motion.
Okay, so we have a motion and a second for the Reedy amendment found before you in the reprint.
Is that a favorable?
Yes. Have a motion and a second for a favorable on the Reedy amendment you have before you on the reprint. All those in favor, raise your hand. I'm sorry, I apologize. Yes.
I
Do you
just-
want to turn, your mic is hidden behind the
Oh,
laptop.
sorry.
There you go. Thank you, Senator Lamb.
Yeah, I would urge the committee to resist this amendment. I think it's not necessary. I think it really impinges on standard of care. I think this decision needs to be made between a provider, their doctor, or other provider and the patient. And this really closes the door on, any circumstances. And we just don't know what's coming down the pike when it comes to medical care. So I would urge the committee to resist.
Okay, is there any further discussion on the Reedy amendment? All those in favor of the Reedy amendment, raise your hand. That is 3. Those opposed, raise your hand. And that is 8 plus. Okay, so that amendment fails. We have also in the same reprint, an amendment by the sponsor. Can you remind us, Nathan, of what the sponsor amendment did?
Yes, the sponsor amendment authorizes each healthcare provider offering gender affirming treatment for which an MCO has an active contract to consent to being included in a certain report or to be publicly listed as part of the department's annual report.
Okay, are there any questions regarding the sponsor's amendment? Is there a motion? Okay, I have a motion and a second for a favorable on the sponsor's amendment you have before you in the reprint to 460. Senator Mounts,
I have a quick question about the sponsors amendment. What exactly does it do?
one more.
So what is the consent for?
So under the bill as introduced, each managed care organization is required to submit to the department a report that includes certain information, including the name and location of each healthcare provider and the types of gender affirming treatment that they provide. The first part of the amendment says that for each healthcare provider offering gender affirming treatment with a managed care organization that has an active contract, the provider must consent to being included in that list that includes the name and location of that provider. So the sponsor offered this amendment to address concerns about violence against healthcare practitioners. The second part of the amendment says that the report that must be compiled by the department on geographic access to gender affirming treatment across the state would include for each healthcare practitioner offering gender affirming treatment to a program recipient who consents to their inclusion in the report for the same reason.
So it's saying if you want to have your name withheld, you can.
Your name and location and the types of gender affirming treatment provided can be withheld from these two reports. It makes no changes to other reporting of health data or billing
Right.
information.
So the information is still going to the department, correct?
Yes,
Okay, I just wanted to verify that.
thank you.
Okay, any additional questions, discussion on the sponsor amendment? We had a motion and a favorable for the sponsor amendments on Senate Bill 460. All those in favor, raise your hand. I'm sorry, can I get the hands raised again for the sponsor amendment? That's unanimous. Okay, now, yes, Senator Hayes.
Sponsor on this one.
Yes, can we get through? We have one more amendment before we get to that. Yep. So you want to go back through and remind us of, you have another reprint on your desk reflecting an amendment offered by Senator Mounts.
That's correct. And in that second reprint that indicates that it's reflecting the amendment offered by Senator Mounts on page 5 of 5, It specifies that a parent or legal guardian must consent, parental or legal guardian consent must be provided for individuals under 18 years old who are seeking gender affirming procedures authorized under this section.
Okay, Senator Guile.
Thank you, Madam Chair. I guess I'm just wondering, I mean, throughout the bill, we use the word treatment. And in the amendment offered by Senator Mounts, he refers to procedures. And I guess I'm just not clear because, you know, treatment is defined, to include hormone therapy, puberty blockers, and including, everything that's enumerated on page 3, Roman numeral 2. So I don't know what procedures means.
Senator Mounts.
I think you brought up a very good point. And I want to apologize for not having the time to give this to committee council before this morning. And in fact, the amendment was drafted based off of the discussion that we had yesterday during our voting session. And I wanted to make sure at least we had it, because that was one of the discussions is conceptually, I would make a vote, but I don't have anything before me. So I wanted to make the effort to put it forward. I would agree to change that word treatment to procedure, but I don't know if we can do that
Procedures for
here
treatment.
manually, Chair. Is that possible to do a manual strike and strike the word
That's fine.
yeah, because that would make it consistent with the bill.
Is there any objection to the amended amendment? I don't see any. So in front of you, you now have the Mounts amendment with the word treatment in place of the word procedure. Is there any further discussion? Senator Lamb.
So just to be clear, the distinction here, so since we're doing conceptual amendment to change it from procedures to, you said treatment?
Yes. Page 5.
Mhm. Why do we think this is necessary if we already have parental consent for those under the age of 18?
Well, clearly in practice, reality doesn't always play out the way it's conceived. Moving forward, there is an enormous amount of interest, emotion, care, however you want to describe it. It's funny, last night, the first thing I pulled up on the news was an announcement about gender affirming procedures in kids. And as we move forward with these procedures, to make it explicitly clear as possible, to me is a very important part of the policies that we're promulgating. And by including this in the language of the bill, to me is just a necessary step in putting the bill forward. It doesn't undermine the bill. It doesn't change anything with the bill. It just clarifies. It doesn't interfere or impede anybody's ability to make any decisions. It just clarifies and doesn't, by having it explicitly in the bill, it's clear, there's no doubt about it. And for that, as a necessary safeguard, which we do with a lot of bills in a lot of different situations. So I respectfully put this together with a lot of caution and concern, not to be taken as trying to undermine what the intent of the bill is, but just if the bill's going forward, this would be a good common sense policy measure that should be explicitly contained in the bill.
Yeah, so, and I understand the sponsor amendment's point. I think I'm concerned about it because I think it's duplicative. It's already in parts of the statute. So when I was saying earlier that those who are 18 or under the age of 18 can't consent, it's already in I think Health General 2-102. where there's very clear language, and I think all of the parental consent language is already built into that part of the statute. This is just the Medicaid part of the statute where I think it fits less in. I think it would fit more appropriately in kind of the general health part of the statute where it already is in 20-102. Where it states clearly the minor must have the same capacity as the adult to consent. It's already all covered under there. I don't think this is necessary, and I think it just is duplicative and could cause some unintended consequences in the Medicaid part of this section of the code, which is what this bill deals with.
I'm sorry, Senator Mounts?
Yeah,
did
yeah,
you
well,
want-
that's a little different than what's in the amendment, having the mental capacity. This clearly states, until you're 18, you need legal guardian or parental consent. I think one of the concerns that comes from a lot of parents is that, as we're developing healthcare and healthcare delivery, especially in the school settings, and we're changing the age of majority to make your own decision, that parents are losing control. There's things happening with kids and healthcare in schools. There's two sides to those arguments. There's one of concern and there's one of delivering healthcare. It's a very contentious issue, and it divides people. It doesn't bring them together when the common goal is something that everyone rallies around, which is the health of children. And that's what we're talking about is children. And with that in mind, and in particular with this, to me, it makes sense just to make sure that this is clearly defined. There's a lot of things going on right now in the school, right in schools through school-based health centers, wellness centers, things like that, where we're expanding right now. It just recently has been expanded, what children can do on their own without parental consent. And that's likely to continue to expand if you follow the trend in what's happening in healthcare and the health of children and the age of technology. So if this goes forward, I think that argument, in light of all the things that are happening, it makes this even a more important consideration, especially because this really doesn't do anything to undermine, at least from my perspective, and certainly not the intent of this, to undermine anything in the bill.
Right. I think it just has unintended consequences when you bring consent language over into the Medicaid part of the code where it literally all resides in 2-102. So if you look at that part of the health statute in 20-102, it lists explicitly what a minor can consent to. And this is not there. So it says a minor has the same capacity as an adult to consent to treatment or advice for drug abuse, alcoholism, venereal disease, pregnancy, contraception, physical exam or treatment for an alleged rape or sexual offense, admission to a detention center, and HIV. So they can't consent to this already on their own. It's duplicative, and it's really just bringing in the Medicaid part of the statute into consent, where consent already resides in a different part of the statute. So I think it's not appropriate and also duplicative.
Okay, thank you, Senator. Can I go to Senator Guile and Senator Hayes?
Thank you, Madam Chair. I guess this is minor, but I don't mean to make a pun, but I'm just thinking, what about emancipated minors? Is this, I understand the senator's concern for parental involvement in these types of treatment or these types of treatments, but I guess I'm not sure where it is exactly in the code, but
Let me have the council respond to that rather than.
thank you.
asking
I appreciate it. Thank you, Madam Chair.
So there's a bit of nuance to whether emancipated is included, but referring to 20-102 of the Health General article that Senator Lamb was alluding to. Senator Lamb listed off some specific areas where a minor has the same capacity as an adult to consent to treatment, but 20-102 in subsection A includes a few more general provisions. It says that a minor has the same capacity as an adult to consent to medical or dental treatment if the minor is married, is the parent of a child, or, and then this is the provision that's most analogous to emancipation, but isn't that isn't that specific. It says same capacity to consent to medical treatment if the minor is living separate or apart from the minor's parent, parents, or guardian, whether with or without the consent of the minor's parent, parents, or guardian, and is self-supporting regardless of the source of the minor's income.
Okay, I had Senator Hayes answered, question answered. Okay, so we have before us, I'm sorry, Senator Mounts, one more. Okay. You can. And I have a motion and a second for a favorable on the Mounts Amendment found on the motion and a second for the favorable on the Mounts Amendment to Senate Bill 460, which you have on the reprint before you. All those in favor of the favorable on that amendment, please raise your hand. Okay, we have 1, 2, 3, 4, 5 favorable on the Mounts Amendment. Those opposed, please raise your hand. That is 1, 2, 3, 4, 5, 6. That amendment fails. All right, so now we have before us Senate Bill 460 as amended by the sponsor. Are there any questions or any further discussion? Senator Hayes. Oh, we do have a request to add Senator Hayes as a co-sponsor. Any objection to that amendment? So you now have before you the amended Senate Bill 460. I'll entertain a motion. Have a motion and a second for a favorable on Senate Bill 460 as amended and amended. All those in favor, raise your hand. That is 1, 2, 3, 4, 5, 6, 7, 8. Thank you. Those opposed, raise your hand. 1, 2, 3. That bill receives a favorable with amendments report on an 8-3 vote. Thank you. Next bill.
Next bill is Senate Bill 699, which establishes the Equitech Growth Commission and Fund in TEDCO to support economic competitiveness and inclusive growth of emerging and advanced industries in the state. TEDCO must staff the commission, which must develop and report on a strategic plan and 10-year goals by July of 2025 for growing the state's innovation economy. As amended, for each of fiscal years 2025 through 2033, the governor must include an appropriation of $5 million for the program in the annual budget bill. And the bill takes effect in July of this year, and then provisions related to the commission terminate in June of 2025. So as described, the amendments require the governor to include an annual appropriation of $5 million to the fund and adds 2 additional members to the Equitech Growth Commission established by the bill that was requested in testimony that the committee received. Identical amendments were added to the House bill.
Okay, are there any questions on the amended version of Senate Bill 699? Senator Ellis?
Yeah, thank you, Madam Chair. So listening to the budget language, Nathan, reflected back on the chair of budget and tax saying we don't really require anymore, but we say governor may. Is that language appropriate in this, or this is a different circumstance?
So the amendments that the House considered and adopted includes shall. It struck the word may and included the word shall. The rationale, as was explained to me, was that this is a program of a level of importance that they wanted to make sure that the funding was required.
Okay.
The program in general is the result of a joint chair report.
Senator Reedy?
Is the fiscal note still at 250 million for the next? Or did I misunderstand?
No, it would be 5 million for each of the, apologize for not having done the math in advance, but $5 million for 25, 26, 27, 28, 29, 30, 1 through 2, 33. So it's 9 years at 5 million a year.
And it's aimed at the startup infrastructure for, this is the Equitech, right? So it's.
Yes.
Okay, for startup infrastructure and, okay, all right.
Senator Ellis.
Yeah, thank you. So I'm just trying to process the answer for my last question. And so I think Senator Hayes mentioned it was in the joint chairman's report. So what's the significance of that report with what we do?
I was just recalling about the process started a couple of years ago with the joint chairman's report that led to the form. Oh.
Yeah.
What's that?
It starts with
Oh.
budget language and requiring a report to bring forward information.
Okay.
It starts with budget language generally that requires or requests that an entity do some background and research on a subject to bring forward recommendations. So this bill was formed as a result of a process.
Okay, and that's
Yeah.
why the shall instead of may. Probably.
That was just me thinking out loud, but
Okay,
yeah.
all right. Well, thank you. I appreciate
Thank
your
you for
thought,
having
Madam
me
Chair.
go on camera with all.
I'm sorry.
Senator Beidle.
Quick question, Madam Chair. Thank you. Has B&T already voted to approve this? Just curious. Yes. thank
They're
you.
second on the bill and so would have to vote separately, but the bill is agreed to. The B&T has been consulted in advance of finance voting on this bill.
Okay, Senator Reedy.
And if I could just have clarification one last time, why is this is extra money for TEDCO for this purpose? Why is what they're already doing not doing this? Or why can this not come out of their current? I know it's a policy question, but it's been a while since we had the hearing, so I'm just trying to be sure I understand.
Do we? You want to respond to that? Thank you.
Does my question, ma'am, does my question make sense? Would you?
Yeah, thank you for the question. So as the chair mentioned, this is the result of joint chairman's report language that first instructed TEDCO to conduct a study on Maryland's current competitiveness in our innovation economy and our system. So the study pointed out to areas where Maryland is lacking and declining in that. One of the things that comes to mind is our current workforce growth in the innovation economy is at 1.6%. The national average, not top of class, the national average is 4%. So what this fund will do, it will help the state, with TEDCO being the lead in that, distribute this additional funding to help scale and stitch our innovation economy as it relates to infrastructure and programmatic investments, as well as things targeted towards workforce development. So that additional funds will go to supplement the ecosystem flowing through the TEDCO budget. So it will be enhancements beyond what TEDCO is currently doing in the space.
Is TEDCO already doing some of this stuff with the current budget, but this will accelerate, or is this totally new?
It's accelerate, it will be new funding and supplemental funding, if that helps answer your question.
And okay, and then the private sector, they'll be a part of this as well. They'll be able to it'll be like matching grants.
Yes.
That kind of thing.
Yes. So, and they are included with representation on the commission itself, because if we at TEDCO firmly believe if we're not doing this hand in hand with the private sector in collaboration with our nonprofits and our government sector, this ultimately is not going to be the success we need it to be.
And North Carolina and Virginia have done something very similar to this recently.
Correct. So
Okay.
North Carolina just passed a $2 million fund specifically doing this. Virginia's is more, theirs, I believe, is at 15 million annually.
Okay, thank you very much.
Certainly.
Thank you, Madam Chair.
Thank you. Good questions. Thank you very much for those answers that I could not myself provide. Thank you. All right, so we have before us, I moved my bill.
699.
Senate Bill 699 with amendments. Are there any questions? I'll entertain a motion.
Favorable.
I have a motion and a second for a favorable on Senate Bill 699 as amended. Hang on a minute. I'd like to amend. Oh, I'm already on it. Never mind. Okay. We have we have in front of us Senate Bill 699 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report as amended. Next bill.
The next bill is Senate Bill 871, which as amended establishes a work group to identify alternatives to examination requirements and develop recommendations for an assessment method for independent practice as specified. The amendment strikes provisions offered by the chair, I should specify, strikes provisions related to a moratorium on certain testing requirements for social work licensure, provides for the composition of the work group, requires the Department of Health to provide staff to the work group, establishes an additional reporting requirement, extends the termination of the Board of Social Work Examiners to 2025 in line with the other health occupations boards that have been already considered by the committee, and strikes provisions of the bill, making the bill an emergency measure.
Hey, are there any questions? Senator Guile, then, yes, Senator Guile.
I'm sorry, maybe it was, thank you, Madam Chair. And I'm sorry, maybe it was already said, but so what did we end up doing with the exam?
The provisions related to the moratorium are removed from the bill by the amendments offered from the chair.
Okay, so so that means that the exam would just stay as is, right?
Correct.
Okay, thank you.
Senator Lamb.
So are we going to not take up Senate Bill 730, which is the sunset extension?
The sunset extension is included in this bill. It's on the bottom of the first page where the board is extended to 2025 in line with the other health occupations boards that have been considered by the committee.
Okay. And the reason I'm asking is because I had an amendment, I guess, drafted to the sunset extension version of the bill that would simply require the Board of Social Work to, within 10 days after the initial receipt of an application, notify the applicant whether the application is complete. This came up during the hearing as I think a provision that the Board of Social Work was okay with. I didn't know that Senate Bill 730 was not going to come up, and I think it's in the bill folder for that because I think we did provide this amendment to council. So I have this amendment, not conceptual, it's written here, and it brings in parts of the code that are already referenced here. So it's pretty standalone, can be read. Are we open to having this amendment so that it basically requires the Board of Social Work to open the application up within 10 days so they can notify the applicants if it's not complete? So because we were hearing that applicants were waiting until day 50 before they opened it up, and then they were notified it wasn't complete and they were waiting a really long time.
So does anyone need Senator Lamb to make copies of his?
I have copies.
Print, oh, would you want to distribute your amendments for
Sure.
consideration?
Sure, yeah.
I have an amendment at the desk.
So much speed of reading.
Thank you, sir.
So just to briefly put it in context, you'll see in the reprint, there's section 19302 and 19304. Obviously, in between there's section 19-303. That's in this amendment, as you see here. And obviously the fully capitalized parts, those three lines are the amendment. So it's really just to have them open up the application of a potential licensee sooner so that they would not find out at the very end of their 60-day period.
Thank you. What I'm going to do is ask you to hold that amendment because Senator Guile has had her light on for a minute, and we'll take her question and then come back to you, Senator. Senator Guile?
Thank you, Madam Chair, and with apologies, I don't have a question on Senator Lamb's amendment. It's more so just so I understand what we're doing here with SB 145 and with SB 1871. So we're doing a temporary license for 2 years with the option of people could take the exam and then doing a work group to study. I like it. Thank you. Thank you, Madam Chair.
Thank you. Back to Senator Lamb.
I don't know if I have anything else to add. It's pretty straightforward. I think, yes, I would like to move the amendment.
Have a motion and a second for a favorable. You saw me going for the button. I didn't want to be called on not being consistent. I was like, fails for elect. That's right. That's right. You guys expect nothing less. All right, so we have a motion and a second for a favorable on the Lamb amendment to Senate Bill 871. Are there any questions? All those in favor of the amendment, raise your hand. Seeing no opposition, that amendment is adopted. You now have Senate Bill 871 before you with amendments by the chair. Are there any questions on the chair's amendments? Okay, seeing no questions, no opposition, you have Senate Bill 871 with the chair's amendments. Yes, Senator Ellis.
I apologize. Could someone, I don't know, summarize the entire bill as amended? Just 30 seconds. Elevator
With
speed.
the additional amendment from Senator Lamb, Senate Bill 871 would establish a work group to identify alternatives to examination requirements and develop recommendations for an assessment method for independent practice. And that happens in the second half of the bill, beginning on page 4 of 5 of the reprint. The amendments that are offered by the chair strike provisions related to a moratorium on testing requirements, adds a sunset extension to 2025. And Senator Lamb's amendment would require the board within 10 days after initial receipt of an application and after the receipt of supplemental documentation to notify the applicant whether the application is complete.
Okay, we have before us an amended version of Senate Bill 871. Are there any questions? I'll entertain a motion. Motion and a second for a favorable on Senate Bill 871 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. Colleagues, this is the season of flexibility, and we're going to have to be able to move on the dime during these final days, hours before we get to crossover. So Patrick has an addition to the list for our consideration. Patrick.
So this is Senate Bill 648. This is electronic health networks and electronic medical records, nursing homes, release of records. So this is the bill that would authorize a nursing home that contracts with or uses an electronic health network or electronic medical record vendor to direct the vendor to release patient medical records or electronic healthcare transactions to a business associate of the nursing home. Then a network or records vendor releasing these patient medical records or electronic healthcare transactions under the bill must release the records or transactions in an electronic format that conforms to certain specifications, must make the records or transactions available on a regular basis and release the information in a timely manner to support patient care and monitoring, and may not restrict, limit, or charge a fee for the release of the records or transactions. This was, so a reprint in front of you has a couple of amendments, which I think the chair is offering, which I think aims to address some input from the Board of Examiners of Long-Term Care Administrators, and also narrows the prohibition on the charging of a fee a bit. So the amendment clarifies that that if the nursing home contracts or uses an electronic health network or electronic medical record vendor. This authorization, the nursing home, with the consent of the patient or the patient's personal representative as required under HIPAA, may direct the network or the medical record vendor to release the records. So it just makes clear that that release of information must have those consents in place from the patient and the patient's personal representative under HIPAA. And then the Second Amendment prohibits a charging of a fee to a business associate contracted with CRISP to improve nursing facility quality through data integration unless the fee is approved by CRISP. So it narrows the prohibition on the charging of fee to this type of transaction when it's pushing this information to the state designated health information exchange, CRISP.
Thank you, Patrick. Senator Hayes.
Thank you. Thank you, Madam Chair. I know you said that it addresses some of the issues that the Board of Examiners for Long-Term Care brought up, who submitted written testimony unfavorable. Have they been consulted since this? And I know Chris came in support of the original bill as drafted, but there's some implications to them as well. Have they been consulted about the amendments, and are they now all still favorable?
I haven't been in touch with the Board of Examiners of Long-Term Care Administrators or the Ombudsman. I just had a brief conversation with my council counterpart over in the House, and I know that some of these discussions have been happening. It's my understanding that this
does seem to address the issues that they raised in their written testimony.
Yes, and I believe that CRISP's support for this bill wouldn't be impacted, with the amendment, because what it's doing is it's making clear that limitation on fee is really specifically when there's a vendor that's providing, that type of support services for the transmission of information to them.
Gotcha. All right. Thank you. Appreciate that.
Thank you. Are there any additional questions on the reprint version of Senate Bill 648? Seeing none, I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 648 as before us. All those in favor, raise your hand. That bill receives a unanimous favorable report. Thank you all very much. Good work, staff. We're gonna go off. That concludes our voting session.